Let's start. Yeah. Hello, good evening, Namaskara. So I cordially welcome you all to this health webinar. This breast cancer awareness webinar is completely organized by Vidyadan Foundation. Vidyadan Foundation is a non-profit organization dedicated to empower underprivileged children, youth, and also women through education to bring a sustainable change in their lives. We conduct both offline as well as online activity for the benefits of the society. We are virtually connected both offline across length and breadth of this country, and not only within India, like across the world. So coming to today's webinar, breast cancer, the awareness program, October is known as a breast cancer awareness month. Coming to the fact, breast cancer is the most common cancer in women in India. 27.7% of all new cancer detected in women in India in the year 2018 were breast cancer. One woman is diagnosed with the breast cancer in India every 4 minutes. India's predominant young population, and hence the number of women being diagnosed with breast cancer in the age group, is only going to increase. So every woman needs to be aware of this disease, its symptoms, and its effects to avoid the future health crisis. So we have our knowledgeable resource person to make you more aware of this topic. So firstly, I would like to welcome our speakers. Dr. Kriti Ajdam from Hyderabad completed her MBBS from Subbaya Medical College, Shimoga, and now she's pursuing her post-graduation in OBG at Vaidehi Medical College, Bangalore. So I wholeheartedly welcome you, Dr. Kriti, to this webinar.
Thank you, Hasan Mukhi. It's my second association with Vidyadan. I hope this goes well.
Thank you. So further, I would also like to welcome our next speaker, Dr. Madhupriya from Mallu. She completed her MBBS from Srinivasa Institute of Medical Science and Research Center. At present, she is pursuing her PG in OBG at Vaidehi Institute of Medical Science, Bangalore. So I welcome you, Madhupriya ma'am.
Thank you, Hasan Mukhi. I'm glad I'm here.
Thank you. So I welcome you both of you to this webinar. So without wasting your time, let's get started. So over to you, doctors.
Okay. So I think I'll start. I'll go with the introduction and few basic things like what is cancer and what's breast cancer, the incidence and the risk factors, signs and symptoms. And then Kriti will talk about the treatment, the screening process, self-breast examination, and the investigations needed, follow-up if required. Okay. So this is the month of October and the month of breast cancer. So, but why is it important for only for one entire month to be dedicated as breast cancer awareness? So, as you told, about 1/4 of the cancers are breast cancers, and among females, it's the most common cancer is the breast cancer, not just in India, throughout the world. And also the mortality rates because of cancer is very high due to breast cancer. But why is it more important, especially in India? It is because there's a lot of stigma around breast cancer in India. Maybe because of the patriarchal society, and people are not much aware. There's this awareness deficit among women about breast cancer. Even now, we've seen a lot of patients coming with the final stage 4, stage 3. They would have noticed the lump, the cancerous lesion so many years ago, but then they wouldn't want to go, thinking that it's just painless, it's just a mass, so why do we have to go, it'll subside. So I think this is really important, and you've taken an initiative about to bring about this webinar, so that all the people around would have this awareness, not just women, maybe the men in the house also know about it. So then let's talk about cancer. What is cancer? Cancer is nothing but uncontrolled division of cells. So every cell divides, but however, the cells die. And also there's a limited number of divisions that a cell has to undergo. But here, there's no controlled limit. There's no limit for the cells to divide, which would lead to a lesion, a cancerous lesion. So that is called cancer. So then, what is breast cancer? What are the signs and symptoms and risk factors? first let's talk about the risk factors of breast cancer. So if you talk about that, then most importantly, the age of the female. So as the age increases, the risk to the cancer increases. And this breast cancer is a hormone driven cancer, meaning estrogen and progesterone, the most important hormones in the women, play a role. So the duration of which the female is exposed to hormones play an important role. So how does this duration differ from one person to the other, like one female to the other? So it depends on the time at which the female attains the menarche. Menarche is the first period a female has. So, and the time at which they attain the menopause. Menopause is the end of their periods, if we say. So, if a female has early menarche and a late menopause, so the duration of exposure to estrogen and progesterone, the hormones, the female hormones, would increase. So, if a person has late menarche, for example, and an early menopause, so the duration would reduce. So, the duration of exposure is again less. So, such women are have the less propensity to have breast cancer. So, that is one, because it is a hormone-driven cancer. So, if the next would be pregnancy. We call it as nulliparity. Nulliparity meaning not having any children. So if the woman doesn't have any children, so throughout her reproductive age, she is exposed to estrogen and progesterone. So during pregnancy, what happens is the levels of these hormones reduce. So the exposure would reduce. So during the pregnancy would be what, 9 months. If she has had like 2-3 kids, 2 to 3 years of pregnancy would be there. So then she wouldn't be like 2 to 3 years of reproductive age. There is no exposure to these hormones. So that's why not having kids is again a risk factor. Also, lactation. Previously, like around our grandparents, our mothers used to feed for about 1 year or 2 years, prolonged duration. But these days, most of the women are working women. So they don't, they maximum they would feed is about 6 months. So, but if the lactation is prolonged, meaning if the breastfeeding is prolonged for about 1 year, again these hormones are suppressed. Estrogen and progesterone levels would be low. So for 1 year she has not had much exposure to estrogen and progesterone, which is really important. So such small things, if the women knows, if everyone knows about it, it plays a great role. And also the age at which she has had her first child. Earlier they would have the first child by the age of 20 years or 25 years, but these days women get married by the age of only, by the time they study, finish their studies, get settled, it would be 30 years, have the kids by the age of 32, 35 years. I'm not saying that's not right, but again that is also a risk factor. So maybe all these factors are leading to increase in incidence in breast cancer. Today in India, every one among 25 women are diagnosed with breast cancer, and about 25 to 25 or 27% in the entire world are diagnosed to have breast cancer. And also the mortality rates are still very high for breast cancer. So yeah, okay, let's not deviate. Talking about the risk factors again, genetics also play an important role. However, if you see genetics, the rate, there are two types. One, genetics, or the other is the sporadic. Sporadic meaning which is not familial, meaning which doesn't run in the family. Genetics is the one which runs in the family. You might think, okay, genetics, breast cancer, the mother has breast cancer, daughter would have breast cancer, great grandmom, grandparents. So, but however, 90% of the breast cancers are because of mutations, because of sporadic, meaning they're not because of they're not hereditary. They do not run in the family. Only 10% of breast cancers run in the family, and the most common gene related to that is BRCA gene. I guess most of you would have heard about that gene, BRCA. It's called BRCA1 and BRCA2 genes. So only 10% of the breast cancers are genetic, but 90% are sporadic. Sporadic meaning there will be mutations in the cells which would lead to the cancer. Why mutations? Because of various environmental factors such as smoking, alcohol. All these also lead to are the risk factors for breast cancer. And talking about now these are all the risk factors for breast cancer. Then when we talk about symptoms, what are the signs and symptoms that a person has to look for breast cancer? Most importantly, it would be the mass or the lump in the breast. But however, not all lumps are cancerous. Around 90% of the lumps are not malignant, not cancerous, and are benign. So then only the 10% of the lumps are cancerous. Then how do you differentiate what is benign and what is cancerous? So how do you differentiate? Let's talk about those 90% of those lumps which are not malignant, which are not cancerous and are benign. If we talk about the age group, among reproductive age group women, mostly young age, around 18 to 25 age group. So that would be most commonly would be fibroadenoma. Around 1 in every 5 to 10 women would have had this. Fibroadenoma is a small mass, small lump in the breast, but again it will be firm when you touch. It will be firm to hard. But however, it is called a mouse in the breast because it just moves within the breast. But there's nothing to worry about. Most of the times, there is no need of any surgical intervention for that. But however, if it is very large, like more than 5 to 10 centimeters, it would need a surgical excision. So why I'm saying this is because 1 in every 5 to 6 women, like in younger age group, would have had this, and they would want to know what it is. So most of the times it is benign, but how will you confirm it is benign or malignant? That would be through ultrasound, and if needed, there would be biopsy. Kriti will be talking about all this investigations and treatment. But this is the most common lesion. Most common lump would be in the breast would be fibroadenoma, which is a totally benign condition. So this is one. One of the symptoms of breast cancer would be lump or the mass in the breast. But however, when you feel it, when you touch it, it will be hard or it will be very firm. It will not be soft or you cannot indent. And it will be painless. When you see in the hospital, women with breast cancer would come and they would say, and we would ask them, like, why didn't you come, why didn't you come early? And they would say, ma'am, this was just a mass in the breast and it was painless. If it was painful, maybe we would have come earlier, but painless thing is the most important symptom that you have to look out for. So that is the most common symptom. And if you see, there would be some spontaneous discharge from the nipples, would be the bloody discharge from the nipples, which is again a symptom of breast cancer. Or the cancerous lesion would have involved the nipples, which would cause puckering, or what do you say, indenting, or inversion of the nipples. And if the mass is very large, then it would lead to the loss of symmetry, meaning both the breasts, both the nipples would not be at the same level. So one size of the breast of the one size, which is like the breast which is involved, which has the cancerous lesion, might be larger compared to the other breast. So there will be inequality between the size of the breasts also. And the skin of the breast, there'll be again swelling and edematous, or it would look like, in simple words, in layman terminologies, it would look like an orange peel. So whenever you see the orange, there would be few dots over the orange, few puckerings over the orange peel, right? So the skin would look like the orange peel. So that is also one of the symptoms of breast cancer. But in case if it's a later stage, it would have had metastatized to other organs. If the other organs are involved, for example, if the bones are involved, the patient would have had severe back pain or multiple fractures. Or if for example, metastatized to liver or liver or kidneys. So then it would lead to other symptoms related to those organs. But these are the most important symptoms that a person has to look out for in breast cancer. So I think I'll hand over to Kriti to talk about it more.
Thank you, Madhu. And I think Madhupriya has briefed us about everything without catching a breath. So I think I better ask you all questions after this. How many of you have heard everything? So let me I'll just go brief about how do we diagnose, how do we go about breast examination, and I will not go too much into the medical terminologies. Maybe it will get too much. So just let's concentrate on self breast examination, awareness towards our own breasts, and how do we diagnose, and how often do we diagnose, and how much are we at risk for. So I think that's good enough. So just imagining that this is one of the breasts. This is one of the breast. So we start the examination. There are three kinds of examinations that you can do. One is dial clock method. Dial clock method is, this is the nipple area and this is your breast. Okay, so you start from inside out and you feel for any mass. Is everybody understanding? So this is how you go about. So dial clock method, you go in a clockwise method. Okay, so this is your dial clock method. Or you go by a horizontal method. You start at one end and you go with horizontal method. Okay, you start and feel for the masses. Or a vertical method, you go about like this. Okay, these are the three defined methods of self-examining yourself, and mostly any breast mass is likely to be on the outer quadrant. I mean, if this is the breast, we divide this into four like this. Okay, so 1, 2, 3, 4 quadrants. Okay, so it is most likely to be on the outer quadrant, outer upper quadrant, any most likely the lesion supposed to be. Okay, so more you're aware of your breast every time, like you take a bath or you tend to sleep or anything, weekly once, it's better to self-examine yourself for any kind of breast or any heaviness you feel in the breast. It's basically as simple as awareness towards your own breast, so that at one point when you really feel a lump, you know that your breast did not feel the same way a week ago. So that's the importance of the self breast examination. So coming to what investigations you can go through, or how you can go about breast cancer screening is, there are multiple ways, which is ultrasound, which is mammography, which is MRI. You can start by best screening method right now is mammography. So you can start by at the age of 40 years if you don't have any predisposed risk factors. But if you have any strong family history and if you have a strong family history, your breast cancer percentage increases by 20%. So you have to start screening by 35 years of age. Okay, which is screening by ultrasound, mammography, MRI. Or if you have a proven BRCA mutation, or you have a first degree relative who has a proven BRCA mutation, then you have to start screening by 35 years of age, at which for sure MRI is done. At 30 to 35 years age, it is switched to mammography. No, you start by 25 years of age. If you have a BRCA mutation, proven BRCA mutations, from 25 yearly you do an MRI, then you switch to mammography. And if you're a younger female with dense breasts, then you have to go for an MRI. Is that good enough? So after this, we go about USG and MRI. USG is mostly ultrasound, is mostly used to differentiate between solid and cystic masses in a breast. Okay, so it is mostly useful in a pregnant lady with a lump, so that mammography is basically an X-ray. You don't expose the pregnant woman to an X-ray. So pregnant woman or a young female with a dense breast, whatever dense breasts, you go for an ultrasound. And for MRI, indications could be, you have a breast implant or breast implants are very common these days. So whenever you have a breast implant and you have a proven BRCA mutation, you go for a higher investigations like MRI. So there's something called multifocal and multicentral lesion. Okay, so multifocal is in these 4 quadrants of your breast. Multifocal is only in one quadrant of your breast. There are multiple foci of multiple lesions. And multicentral is there are many lumps in your breast at many places. So you can only find that out by self breast examination. And coming to BRCA mutation. BRCA mutation is very important. Important in females as well as males. When it comes to BRCA2 mutation, it affects more males than the female. That is the carry home point, that BRCA2 affects males than the women, and BRCA1. BRCA1 is more aggressive type, and BRCA2 is the lesser aggressive type. So like, I think it's very the famous actress who got treated herself just because she had a BRCA but no symptoms at all. Anyone? I'm sure all of you must be knowing.
Angelina Jolie.
Yeah, Angelina Jolie had a BRCA mutation because her mother had a proven breast cancer. So she got she got herself tested, had a BRCA mutation, and got both her breasts removed, mastectomy done. So there is something called risk reduction techniques, proven risk reduction techniques. When you have a BRCA mutation or you are prone to breast cancers, there is something called risk reduction techniques, which are bilateral mastectomy. Even before you develop a cancer, and you know that you are at a risk of developing a cancer, you remove both your breasts. You can replace it with implants, or you just remove the breasts. Okay, that's what Angelina Jolie did. It reduces the risk of breast cancer by 95%, which is a lot. So bilateral salpingo-oophorectomy is you remove both your ovaries and both your fallopian tubes with the mastectomy. So it reduces the chances of ovarian cancer by 90%, which is most commonly caused by BRCA2 genes. And the other one is you can give drugs like selective estrogen receptor modulators, which is called SERMs, called tamoxifen, which is a famous drug used for breast cancers. So these are the 3 risk reduction techniques which you have when you're already prone to breast cancer, or when you already have a proven BRCA mutation. So these are few techniques for already how to go about breast cancer investigations. Okay, when it comes to treatment of breast cancer, I think like we are all under knowledge to talk about it. There could be surgeries, there could be chemotherapies, there could be radiotherapies, and it can go a long way. But pregnancies, especially breast cancers in pregnancies, are increasing a lot more these days because of the causes described by Dr. That, the decreased breastfeeding and all such things. So when it comes to breast cancers in pregnancy, there's not much you can do. There can only be biopsy, and there can only be a surgical method. You don't go for chemotherapy and radiotherapy. I'm sure Dr. Madhu agrees with me with this. And there are certain symptoms which correlate with breast pain, so I would like to talk about that. There's something called have you all experienced breast pain just before periods? I'm sure all of you have, right? So there's something called mastalgia, okay, pain in the breast, okay, heaviness in the breast, which can usually be confused with a mass in the breast. Okay, when it comes to mastalgia, we have to differentiate it from is it cyclical or non-cyclical. If it's cyclical, it's well and good because of your hormones and because of your periods. It usually occurs at a young age, between 25 to 35 years of age, just before you're menstruating, and your breast will actually feel very lumpy. So that's physiological. But when it's non-cyclical, but it especially occurs in perimenopausal age with a discharge around the nipple, then that is something you have to be worried about. So this is how you differentiate between breast pain and nipple discharges. Nipple discharges could be bloody discharge, whitish discharge like milky discharge, or greenish discharge. Greenish discharge is usually when your ducts of your breast glands are dilated, and they usually have a greenish discharge which can only be treated surgically. And milky white discharge is usually because of hormonal imbalance or anything which has to be evaluated. And bloody discharge, without any doubt, has to be evaluated with further modalities like USG, mammogram, or an MRI. I hope I'm clear with the investigations part. Yeah, that's how you go about. I think this investigations and everything is a much larger part, and that's the responsibility of the doctors. as laymen, our only responsibility is self-breast examination and know the symptoms of when to go to a doctor. You go to a doctor when you feel a lumpy breast. You go to a doctor when you have a pain which is not cyclical, which is not associated with your periods. You go to a doctor when you have a bloody discharge, and you go to a doctor just in case you find your breast didn't feel the same way it felt the last week when you did your self-breast examination. That's the take-home message. That's it. Investigations and all take a higher seat when you know when to go to a doctor. That's the point of the whole class, of the whole webinar, I think. We should be aware of when to go to a doctor. Because late diagnosis leads to nothing. Early diagnosis and early management only leads to better prognosis of any cancers. Anybody has any questions can go ahead.
I have one question. So how likely are women with PCOS getting a breast cancer?
There is no direct relation actually that, these many percentage of people have this much. So, but it's always, there's always a prone risk to it, obviously, PCOS, because there's a lot of estrogen exposure and everything. There's an increased risk, of course, but there is no direct correlation that, PCOS will lead to this much percentage of breast cancer and these many percentage of women. There's no direct correlation like that. See, PCOS is also a lifestyle disease, and breast cancer's basic risk factor, as stated by Dr. Madhu, is also a lifestyle problem. Like, right, Dr. Madhu, like it's also the basis is lifestyle problems. So the risk is always there. Risk is always there, but there is no direct correlation as such.
Okay, thank you.
I have a question as well. So basically, you spoke about removing the breasts when the breast cancer is more. So isn't it dangerous, like removing an organ? Aren't there any other functions performed by it?
See, it is okay that, removing an organ and everything. Yes, I understand in a layman way how you are understanding it, but I think I think all doctors now practice something called evidence-based medicine. So we weigh out our options. So having a BRCA mutation and so when you have a BRCA mutation, there's a this thing that you will mostly eventually lead into breast cancer. So having a BRCA mutation and allowing it to stay and leading it to breast cancer is weighed upon with having a BRCA mutation and removing your breast. So which is better? So obviously the second one seemed better maybe to doctors. So evidence-based practice says so maybe bilateral mastectomy is the way to go. Of course, there's always a risk with it that you might develop like an arm lymphadenitis and stuff like that. But I think there's risk to everything. But according to the evidence-based practice, choosing this has better lifestyle prognosis than having a cancer any day, right?
I agree with her. And just like you say, there's something called risk to benefit ratio. So when you see that, even like she told, there are side effects because of mastectomy, but you have to see which is more beneficial, having the breast cancer, letting it stay and letting it spread, or just, getting rid of it. So I would say the risk to benefit ratio is always high. So that's why it's better to have, mastectomy. And like Kriti said, there are so many studies and so many so many patients have been studied who had a family history of breast cancer and mastectomy. So I think that's much better. We can't say it's 100% without any side effects or anything, but you have to go through that risk to benefit ratio.
Nevertheless, Angelina Jolie is doing great, so I think that's the way to go.
All right, okay.
You stressed on the fact that it's lifestyle problem, but like what comes under the lifestyle? Is it that not breastfeeding for a longer time? Are those the points?
Could be anything. Like obesity is a major risk factor. Obesity is the lifestyle issue right now, and anything that's associated with it, like any habits, alcoholism or cigarettes or anything, smoking as such, and lack of lactation, and prolonged estrogen, like irregular cycles and stuff like that. Everything is lifestyle based. So I think obesity is the biggest problem that we have right now, and that's the direct risk factor for breast cancer.
Okay. And you just said that there are more number of cases where it's more women who are pregnant who are getting this cancer. That's what you said, right? Like,
Sorry if I worded it like that. It's not more women who are getting pregnant. More cases have been getting detected in pregnancy.
okay.
Because when there's a fibroadenoma before at the age of 22, 23, and you have not detected it, in pregnancy it increases in size and then it gets detected.
Okay. Because you said that during pregnancy the hormones are decreased, so it's
Yes.
less exposure. So that is I was logically connecting it. But then you said that it's more in number in pregnant moments.
No, I didn't mean like, the cases have been increasing. Maybe the awareness towards the fibroadenoma increases in pregnancy.
Okay.
Okay, because the size of the fibroadenoma increases in pregnancy. And I stressed upon it because nevertheless in pregnancy, you can't do much. Right. So you can't give a chemo or you can't do anything if a cancer is detected.
Okay.
All I'm telling is you have to take a biopsy and wait. That's it.
Okay. Thank you.
If anyone wants to ask any question. You can continue with this, Madhupriya ma'am and Sukriti ma'am. Any recent, as you told, no? So like I have a really good question, but I don't know how to be that.
Yeah,
Does only women get a breast cancer, or do men to get a breast cancer?
No, that's the
Men
biggest
get it.
myth. Biggest myth that men also get. Percentage is highly unlikely, but when they do get breast cancer, it's more lethal in men than women. And like I said, BRCA1 and BRCA2. BRCA2 is more common in men, and like they say, breast cancer may be common in more women, but when it occurs in men, the prognosis and whatever the results of it is very poor in men.
Okay, so to treat breast cancer in women, one of the methods is removing breasts. How do you treat that in men?
The
You
same.
remove the lump,
Oh, okay.
the non-functional breasts, that's it.
Still we have a time, so if you can emphasize on any important like lifestyle changes in order to prevent this breast cancer in future days, since we are all we're all junk food kind of generation. We always go outside and eat something. So any tips for youngsters like us to maintain a very healthy routine in our life? Like what are things we need to do?
Like Kriti said, obesity is the one of the most important risk factors. So, but why is obesity a risk factor when you think about it? Because in obesity there would be fat. So, fat produces the estrogen hormones, the peripherally circulating estrogen hormones. So, like we all discussed today, breast cancer is a hormone-driven cancer. So, I think when you say obesity, it is a direct risk factor for breast cancer. So lifestyle modifications would be regular exercising and avoiding all this junk food And maybe the habits also changing in the habits, such as smoking, alcohol. Smoking is the most important risk factor in all the cancers, if you have to say. These causes mutations. So I think these are the most important lifestyle changes, like proper nutritional diet, and avoiding smoking, alcohol, regular exercising, at least around 30 minutes in a day, cardio, maybe 5 days in a week. These are the most important lifestyle changes. And a few people would think, now when I've told it's a hormone driven cancer, there would be so many reproductive age group women who are on OCPs. OCPs is oral contraceptive pills. But let me say, there's something called low dose oral contraceptives. These there's no study which has told that there's a direct relationship, or the low dose oral contraceptives would be a risk factor for breast cancer. So it's totally safe consuming oral contraceptives. If anyone had a doubt, I wanted to just clear it off. I think these are the lifestyle modifications you would have to do for avoiding breast cancer, or any cancer for that matter.
What is the most like less, not a very high checkup? MRI is the highest, right? And no, or mammography is
Highest, what do you mean highest?
like if it's just a simple lump that I feel, so what should I go and do first? Like if I go to the hospital, what should I go? Ultrasound. Okay.
Ultrasound, yes. Because young female with dense breasts, it's always ultrasound.
Okay.
Yeah, that's the first screening method that you have to go through. I think I'm right, Madhu? Like it's,
Yes.
going to be ultrasound, right? Yeah.
Yes. So that's the basic screening test which we have to do. And by highest, did you mean most confirmatory test or something?
Yeah, that's the one.
So any day, most confirmatory would be biopsy, tissue biopsy, where you would take the tissue and visualize it through the microscope. But not every person with the lump you would have to do this biopsy, because biopsy is any day. This is not it is what do you say? You have to undergo procedures for that. It's a so that's a painful procedure. So ultrasound, we call it as a screening method. So through ultrasound, you would screen the patients, you would filter out, you would say, okay, these patients would need further investigation, and these are the other set of patients who might not need any further investigations. So basically, the first test you would undergo is ultrasound, but the confirmatory would be biopsy.
Yeah. Okay, thank you.
So will the risk of women with dense breasts getting a cancer more?
Not necessarily. Do you mean with women with dense breast, are they prone to
Prone
more?
to more cancer? No. Okay.
Just that the density of the breast will according to the density of the breast, we tend to give the investigations. If you have more dense breast, then ultrasound is better, because the image is better. But otherwise, there is no correlation like that.
Okay.
Yeah.
Okay. So
Yes,
if one get treated with the breast cancer, like what is the risk of getting other cancers?
Sure. I think Madhu, we just saw a case in your in the hospital where that's a very good question actually. We saw an 84-year-old with a previous history of breast cancer, and she was on tamoxifen, if I'm right?
Yes.
She was on tamoxifen, and she came with 85-year-old. She came with postmenopausal bleeding. So we got I think Madhu got an MRI done, and then you took an endometrial biopsy and everything. So the chances are pretty high, I guess. Right, Madhu?
Yes. These are all like ovarian cancers, endometrial cancers, breast cancers. all these are related. And when the origin of the cancer, when the cause of the cancer, if you say, is genetic, meaning when the genes are related, like BRCA genes are related, then these BRCA genes predispose not to just breast cancers, but also to ovarian cancers, endometrial cancers, and in men, it would lead to breast cancers, prostate cancers, also colorectal cancers, meaning involving the intestine and the rectum. So there are a wide range of cancers that might include along with this. So the case Kriti was talking about, so this is a patient who was diagnosed to have breast cancer. She had undergone mastectomy around 13 years back. And yes, a few days back, she had come with bleeding, postmenopausal bleeding, meaning she had attained menopause, like her periods had stopped around 30 years back. And now she has come with bleeding. So when we did all the investigations we had to do, and we also found a lump in the other breast. So she had undergone mastectomy of one side, but in the other side, there was again a lump which we have not yet investigated. But however, this endometrial cancer we had suspected, and we had to get an MRI done, and it was she was diagnosed to have endometrial cancer. So when you see, she had breast cancer, and now she has endometrial cancer, and also she might have breast cancer again. We could not do mammography because a patient was not compliant, but we have to do the mammography to confirm it. But however, she had family history also, like positive family history. Her sister had breast cancer, had undergone bilateral, meaning both sides mastectomy. Her daughter had breast cancer, and her one of the cousins had breast cancer. So it just runs in the family. So when such patients come, we have to do a thorough genomic study, like all the women in the family has to be studied. And when you think, okay, only the maternal history is important, like mother had, okay, daughter would have. No, even paternal history is equally important. Like in from your father's side, anyone had breast cancer, so that is also equally important, just as maternal factors. So both are important. So you shouldn't just neglect that, saying, "Ha, it's just father side, you don't have to think about it," because like people say breast cancer is very rare in men, and men don't have breasts and all such things. So I think you should just not think about such things. But when there is a positive family history, most of the women in the family should get examined, at least for these two genes. So like for your question, in short, there are other cancers which are related to breast cancer when it is cause of the disease is genetic.
Yeah, that's why when we do a risk reduction surgery, we also do a bilateral salpingo-oophorectomy, which is remove the fallopian tubes and the ovary to decrease the risk of any ovarian cancers, because BRCA2 causes more possible ovarian cancers.
Okay.
Just a second.
Yeah. Yeah. So you have any other questions? Where is Dr. Madhupriya? Yeah, you're here. I want to know about this. How about this? If one gets a treatment and there will be so much of side effect, yes, if I'm not wrong. So, like, how long it lasts, like side effects and all, and what are the side effects that one can able to face during
Very
this?
subjective. That's very subjective, Hamsa. Like chemo, there's a different side effects. There is radio, there's a different collateral damage. So that's very subjective. Depends on the drug, depends on the duration, depends on the. But of course, it's bad. It's not great, but I think right now, I think the nuclear medicine and everything has improved so much that we're able to bring any stage breast cancer out of like at least minimum 5 year survivability. So I think it's pretty good. 5 year survival rate is pretty good right now. But then the side effects and all is very subjective. It's a very broad term that we're using here. So I think with radiotherapy and chemotherapy, different therapies have different side effects. But I think right now the nuclear medicine is so good that we are able to give a 5 year survival rate.
Okay, okay, thank you. So anything you want to discuss? You have a doctors here, gynecologist. Other than that, so you're free to ask.
So I think we should all summarize with like what are the like typical symptoms that you would find when you are suspecting a breast cancer. Anybody?
Can you just repeat the question?
Like if somebody comes to you in your family or your friends and say these are my symptoms, or what are the symptoms of like a breast cancer, or should I be suspecting a breast cancer, what are the symptoms would be?
A lump,
One of the lumps.
bloody discharge, like you said. Orange peel. Yes,
Great. Yeah, I wanted the
something.
answer. Orange peel appearance, pure the orange. Yeah.
So those are the symptoms, and then you go and do the ultrasound, and then it's up to the doctor if it's there or not.
Yeah, right. So lump in the breast, blurry discharge of the nipple, any pulling up of the skin towards inside is one of the like most important symptoms. Any orange peel appearance of the skin on the breast. These are the four main. And there's eczema kind of a thing. Are you all aware of eczema? Like, peeling up of the skin and reddish rashes over the skin, and, increased rise of temperature of the skin. All these are markers towards any breast tumors. So these are all the takeaway. So the symptoms, risk factors, and self-breast examination are the takeaway messages from this webinar, as far as I'm concerned. As like regular normal layman people, we should all know these, so that we know that at an early stage when to consult a doctor.
Is there any particular age when you're supposed to meet a gynecologist? Like we are all in our 20s, so is it like a compulsory that you should go and do some checkup? Like even if you have no problems, or is there any?
Not necessarily. I don't think so. But yeah, like, certain tests like pap smear and stuff like that, like it starts at an early age where, which are all screening tests for cervical cancer and everything. But there's no compulsion as such that, you have to go to gynecologist or anything. But if you have any queries, yes, of course you have to.
Okay.
But otherwise, I don't think so.
Okay, mine is completely off the topic. How do you cure PCOS? The thing is, if you go to normal allopathy medicines, they give you contraceptives. So contraceptives is not good to take in. So
Okay.
how do we do it without medication?
You are Alex C, right?
Yeah.
She went all guns blazing at allopathy. So, I think, OCPs is of course easier way to treat and everything, but I think PCOS just boils down to lifestyle diseases. It's as boring an answer, but that's the fact of it. There is nothing else that you can do for PCOS greater and better than lifestyle changes.
I agree.
I have my consultant in hospital, and anybody who comes with PCOS, before, yes, we used to give OCPs left and right. Then there's a consultant right now whom I'm working with. So then he has told me that, lifestyle changes. He strictly instructs patients that, you will come back to OPD only after reducing 9 kgs. Otherwise, I'm not prescribing you medicines, 9 to 10 kgs. That's the only known treatment to it. That's it.
Okay. Thank you.
Yeah. Yes, Dr. Madhupriya, so you wanted to tell like anything at the last moment. So it already, 8:24.
Yeah. So the take home message, that's what. It's not just now you all know, you've all attended the webinar, so you all know. So I think if you just spread this knowledge to few of your family, friends, your classmates, maybe the maid who comes to your house, your mom, your neighbors, and then they talk to few others. I think this is most important, just the awareness, because we have this awareness deficit in India, most importantly. So just talk in, instead of just having those gossips in the class, once a week, just, talk to your friends. And you might think, okay, self breast examination, what would I do? Just touching my breasts, and it's not going to help and all. But this is the first step. This is why we are saying self breast examination is very important, because once you find a lump, then you go to a doctor, and most of the times you might think, okay, breast examination, we would know if there's a lump and all. But there are so many women who come to hospital who wouldn't have noticed such a huge lump, because most of the times it just goes unnoticed. So just take a minute in a week for yourself, examine your breasts, and talk to your friends about it, your family about it, and spread the awareness. Maybe let's just reduce. We cannot reduce the rate of cancers, the incidence of cancers, but we can reduce the mortality due to this cancer if we identify the cancer at an early stage. So the mortality, at least mortality, morbidity, would be reduced. I think that's most important.
Yeah, true. Thank you so much. Yes, Dr. Kruti, you want to tell like any messages for investors who are watching this?
Yeah, I think from my side, the take-home message would be learn or know when to go to a doctor when you find a lump in the breast. Earlier, the better. More knowledgeable you are about it, more aware you are about it, the better is the prognosis of it. That's it. And don't shy away from self breast examination. That's the only way to go.
Yeah. So thank you. And through this session, I got to know this breast cancer cannot be prevented. It has to be happen. Like it will happen. So, however, the death due to the breast cancer can definitely be reduced and can be done only when you are aware after symptoms of breast cancer and just report it to the doctor on time. So that is the main agenda. Like so, saves life. That's what. So thank you so much, Dr. Kruti Adidam and also Dr. Madhyapriya. So even though in spite of like all the busy schedules, so you are here for like 1 hour. You detailedly like explained everything and you answered every questions. So it was really wonderful sessions. I hope like who are watching and who will watch in future will definitely get something in this, like so much like about breast cancer and everything. So I'm so like, thank you so much for this session. I hope all this audience like Alexi, Marin, Rashmi, everyone, thank you so much for participation and thank you all.
Thank you, doctor, for taking your time.
Thank you so much.
Thank you. This is my second association with Vidyadan, I think. So I've been given this opportunity again. So I think that, that's a good, it's my pleasure to be back here. And I think you've all been a patient audience with me and Madhu today. So thank you all for listening. So I think you're all always welcome to give a feedback if we went wrong anywhere with our knowledge. We are also very at very learning stage right now. So I think the learning should go on.
Thank you, Hamza, and thank you, Kriti, for introducing me to this platform. Actually, she spoke to me and she was like, Madhu, let's talk about breast cancer. I think it's really important and all that. And Hamza, thank you for introducing us to this platform. Thank you so much.
Thank you so much for your like patience. And definitely we're gonna meet you in the next webinar. So we have so many topics. It's like a broad health sector is very broad. I think many of you
Yes.
wanted to ask some other questions other than breast cancer. So Alexi actually asked that. So we have so much topics to discuss. I hope you see you in the next webinar soon. Yeah. Thank you so much.
Sure. Thank you, sir. Thank you, Hamza.